Let me tell you a story of a patient that suits this discussion very well. She was a young woman who traveled from New York City, came to the Coachella Valley. I was on shift. It was in the late evening. I was one of the few doctors that was working in the emergency department, and the woman had right lower quadrant pain. And as part of the diagnostic workup, I asked her if she's pregnant. She said no. I asked her if she's had a recent pregnancy test. She said yes, about a couple of days before she traveled. But we take our own pregnancy tests in the emergency department, and sure enough, it was positive. And her pain was getting worse. And we sent her for an ultrasound, and they found an ectopic pregnancy in the fallopian tube, meaning that the pregnancy was not where it was supposed to be. It was in a very dangerous place, a place that if it ruptured, it could cause her life. And so as the night wore on, her blood pressure dropped, her heart rate went up, and we were suspecting that indeed she was rupturing, and we called the surgeon, who took her to the operating room, and right there her fallopian tube ruptured and she was dying. And so they saved her life. That's what we do in emergency rooms throughout the nation. We save lives. We relieve suffering. We act quickly, without delay, without discrimination, and without politics. That's exactly what the Emergency Medical Treatment and Active Labor Act, or EMTALA, requires. EMTALA is a federal law that guarantees every person the right to receive emergency medical care, regardless of their background, insurance status, or income. It's been the law of the land since 1986, and it is just as vital today as it was then. So let me be crystal clear. EMTALA is still the law of the land, and that includes the right to abortion care when a patient is experiencing a medical emergency, even in states with abortion bans.